So, hello everyone. Thank you for joining us today. My name is Sahar Dowie, PhD in behavioral cognitive neuroscience, but most importantly, a huge lover of the space of behavioral health. I'm with Accenture, Senior Manager, and very, very happy to be here with you today and talking about a very important topic of digitally integrated models and the best way to really access that kind of front door for digital care. This panel is going to really focus on integrated models of care and how we can play a role in better accessing engagement and outcomes. My panelists today are some of the kind of best people to talk about this topic. But before we get into kind of introducing our panelists and having this great conversation, I think given the topic and given how important this topic is, I would really love to take just a moment to kind of do a little bit of a breathing exercise with the group. I kind of had this happen earlier session. It was really great when we got to do that. So if you join me, it would be awesome to do that. So maybe sitting up a little bit in our chairs. Yeah. Great. And you can sort of rest your eyes a little bit or close them if you want to, 100%. And we're just going to breathe in, very deep inhale, 1, 2, 3, 4, and a big exhale out, 5, 4, 3, 2, 1, and we're going to do that one more time. 3, 4, and then exhale out. Amazing, and just getting into that right mindset for having this very important conversation around self-care. Amazing, thank you. So please allow me to get started with sort of introducing our panel today. I really want to start with introducing Clay Nicholas, Chief Commercial Officer of Credible Mind, overseeing sales and growth strategy. Clay, if you want to get us started with telling a little bit about yourself.
Sure, thank you, Sahar. And thank you everyone for being here with us today and spending time with us, and especially to our wonderful clients of Credible Mind for joining the stage with us and sharing their stories around how they're using our product. As Sahar mentioned, I'm Clay Nicholas, Chief Commercial Officer at Credible Mind. Just to give you a quick snapshot of our company and who we are, as our visionary founder, Derek Van Brunt, and our Chief Technology Officer just saw the prevalence increase around mental health services, and especially as that was exacerbated by COVID and other impacts, we saw a lot of the friction and barriers that a lot of you probably felt and that our panelists are going to be talking about in terms of people getting access to mental health services, people waiting in line over 6 weeks to get an appointment. So we thought that there had to be a better way, and kind of what we envisioned and what the team has built is a digital tool that provides access to everyone and provides mental health resources that every member of a population can use, and do that in a way that kind of educates them, engages them in their mental health services, and most importantly, I think, takes people out of that waiting line. So 75% of people that have a mental health service or need, they prefer to start that journey on their own with self-care tools. And what we saw was people either Googling for content or more recently using TikTok to find content. And that content often wasn't high quality. So we built a digital platform that curated all of that content onto one platform, made sure it was evidence-based, and provided that tool as an access point so that people could get immediate help without having to wait. If they needed care, could get triaged and directed to clinical care. But just saw this as a great way to just at least create a front door that people could access at any time and find something relevant for them. So our panel will talk about how that's being used in their specific environments, and we'll share a little bit more about what our product does, but just wanted to set the context a little bit around Credible Mind and what we do.
Awesome, thank you. I want to hand it over to Rachel Goldberg, VP Strategic Partnerships and Product Innovation for NovaWell. Rachel.
Thank you so much. I'm Rachel Goldberg. I lead strategic partnerships and product innovation for Horizon Blue Cross Blue Shield of New Jersey and also for Novowell. Novowell is a spin-off organization that we launched about 2 years ago to help health plans expedite their own behavioral health strategies based on the work that we did for our members in New Jersey. I'm a nurse by training, although I don't practice clinically. And we have been partners with Credible Mind for a few years now, first beginning with our own employees. Our overall goal at Horizon primarily has been to really make each and every employee a behavioral health champion and really to walk the walk in terms of normalizing the conversation around mental health in order to help our own members. So we started with our employee population, our own employees, and then moved into making the service available to all of our insureds, and through our relationship with Novowell, now use the Credible Mind platform as sort of a front door for a lot of Novowell services. So we're very happy to be partnered together and happy to be here today.
Thank you, Rachel. Moving over to Jennifer Butler, who is our Mental Health Director of Education from South Carolina Department of Health.
Good morning, everyone. As Shahar said, I'm Jennifer Butler, Director of Public Education for the Department of Mental Health in South Carolina. We're one of 2 states left in the country that have a public mental health system, meaning we are not a broker of care, we're a provider of care. So there's no privatization of mental health across the state. So we serve all 46 counties through 16 community mental health centers and their satellites, as well as we're the 3rd largest hospital system. Prior to this, earlier this year, we were the largest nursing home provider in the state, and then operate community care homes. And we like to say there are more access points to get to us than the total number of Walmarts, Starbucks, Waffle Houses, and post offices in our state combined. So there's over 1,000 ways that we have portals of access, embedded clinicians in lots of different settings. The reason I'm sharing that with you is that as we talk a little bit more this morning and you hear about how we've integrated it in South Carolina, that system of care has been pivotal in allowing us to do that. So we first began implementing Credible Minds in the middle of the pandemic. Our sister agency, the Department of Health and Environmental Control, hopefully I didn't do that. We became the first 2 state agencies in the country to implement Credible Mind to take care of our employees. It went so well that when we also oversee 988 implementation from the Department of Mental Health in South Carolina, that we decided we were going to purchase it for the entire state. So we're the only ones so far that have done that, and I'll tell you a little bit more stories later about that. But we also did an iteration for first responders, as well as those who work in the 988 continuum space who are dispatchers. Those 2 are about being able to really watch our workforce and how we're managing burnout and turnover. And then I know I'm probably supposed to pause. I'll stop there and let Robin go, and then I'll tell you more later.
That's perfect. Thank you, Jennifer. Perfect. We'll circle back to that. Sorry. And Robin Wood, our program manager at California Value Trust.
Yes, hi. Hi, everyone. Thank you for coming to our session. I represent the employer perspective. We've been working with Credible Mind since before the pandemic, during the pandemic, and now after, in the aftermath. I work for California's Value Trust. We are a school district trust. In California, we have about 20% of the school districts throughout the state as our members, 240 school districts, about 150,000 members. So throughout the state, from border to border to border. So we have a comprehensive number of programs that we offer, and so I'll be able to explain a little bit more in a minute about why we chose this partnership with Credible Mind. I think we were one of the first employer groups to kind of join Credible Mind.
Yeah, definitely one of the first employer groups, and using it in a lot of different ways as an employer that I'm excited for you to share with us.
Exactly. We've used it in many ways. I'm excited to share that with you as well, because we enjoy this partnership, continue to, and look forward to explaining more.
That's fantastic. And before we jump into exactly this topic and kind of talking about the different use cases, Rachel, I would actually love to bring up one thing kind of we've been seeing recently in the news, which is really around some amazing kind of $7.5 million, I think, Series A investment that we recently saw in Credible Minds. So I don't know if you want to kind of speak to that a little bit.
Sure, happy to. So Horizon has been partners with Credible Mind for many years, and decided to really, cement the relationship as we move forward into new markets through our Novowell work. So very happy to have that sort of official tie between the two organizations, and proud of what we've built together.
Yep, I'll just echo that. As a vendor in this space, it's very hard to get your product as an early stage company kind of validated in the market and people to really trust what you're doing. And for Horizon to not only be a customer of Credible Minds directly, to be a go-to-market partner with their organization, Novowell, that has a national behavioral health network that we're the digital front door to, and then be our lead investor as well. I mean, for us, it really just, one, as Rachel mentioned, great partnership that we have with that organization, validation of, I think, the value that we're providing to them, but also that their belief in what we can provide to the market as a partner and to our customers as well, our broader set of customers as well. So really appreciate you asking. We're excited about the money as a startup, as you're aware. You can never have enough money to help you get to where you're going. So we feel like we're well funded now and can really execute on a lot of the vision that we have for this organization.
That's fantastic. Congratulations. I would really love to set the stage really around sort of challenges. So I want to get into the use cases of the product and really how it's being used, because I know there's some great stories here, but let's start with challenges. And we have the right group here to talk about the different perspectives, of course. So maybe we can start with Rachel. Like, what are the most pressing mental health challenges that you think payers are facing right now?
Sure. Thank you for the question. So I joined the Horizon team in 2017. At the time, the space looked very different than it is now in terms of the number of different types of digital and virtual solutions that are available, but the challenges sort of remain the same. Access has always been a problem. There are not enough providers to go around, unfortunately. The availability of evidence-based practices, in addition to that, or ensuring that providers are working to the top of their license and having fidelity to the right evidence-based practice for each particular condition, also is a challenge. There has historically been very high amounts of out-of-network utilization for payers because of the supply and demand imbalance. So that creates a challenge not only for the payer community, but also as consumers of care looking for the right options. And at the top of our list when we started at Horizon 8 years ago was, how do we normalize the conversation and remove stigma? Because you could have a perfectly coordinated network with every possible best practice. And if people are afraid, if we are all afraid to raise our hands and ask for help, that network will go for naught. So that has been part of the reason behind why a partnership with an organization like Credible Mind has been so important in terms of reiterating education, normalizing the conversation, ensuring that once our members or our employees, or our clients are ready to ask for help, that we have the available options for them. So those have been a few highlights of challenges, although there are certainly more.
Jennifer, how about yourself from maybe the public health perspective?
I think Rachel highlighted a lot of the social determinants of health that we know increase vulnerability. And so that big word of access, it matters. I think to kind of take a little step further of, we will never have enough behavioral health providers in our country to meet the need. There will never be enough. And so then what does that mean? That means we need additional partners. We need additional community partners. Not everyone needs to go to a therapist on a weekly basis. We need more upstream intervention. And I think that's where Credible Minds has a place in helping elevate the well-being of everyone in our country. And as we think about sort of that wellness factor, and we think about universal screening and universal precautions, right? I want you to think about Credible Mind as a universal protective factor. So you are giving the audience that has access to this an additional protective factor to bolster them as they meet the challenges that Rachel just described of accessing care.
That's fantastic. And then Robin, same question for you.
Yeah, I agree. I echo with what Rachel and Jennifer were saying too. So part of that, the access issue is definitely there, and the trying to address the stigma too. And that's what Credible Mind really has done for us. It's like, how do we address, I think we're doing better. You know, I think there has been progress that we have witnessed too with our membership, but how do you keep the conversation going? And so the tools that Credible Mind offers, so you do it through, you know, using the strategies that Credible Mind offers through their all of their different ways of bringing that up. So we have the challenge of access, and we have the challenge of decreasing the stigma. And then the other thing we as an employer look at, because we pay the claims, so we're paying. So downstream, we have we are trying to maybe eventually, you know, look at decreasing, you know, the number of claims we're paying, kind of justifying those high costs that we have to charge to our member groups, our school districts. So we've got the three primary challenges that have come up with our treatment spend are depression, anxiety, and substance abuse. So those are kind of our challenges too. So using all of those together, as using Credible Mind as part of our package, part of our toolkit. We offer a emotional well-being toolkit, and it's highlighted by our EAP, our Employee Assistance Program through Carillon. And there's another partnership you have there too with Carillon that just happened this year too, because Credible Mind just keeps showing its value in different ways. And so we have that as well. So I just wanted to mention that.
Fantastic. So I think, I mean, in addressing the challenges, you've been addressing some of the use cases already and how you're using kind of the product. If any of you want to kind of add additional stories and some of the ways you've seen this product really work, I would welcome that here.
Yes.
Clay.
What I'd like to do is just give a little bit of framing around what products we offer,
Yep.
and just because I think that would help our customers then tell their stories around how they might be using those specific products. And when we talk about the challenges of stigma, as an example, a personal story. So I'm a West Pointer, spent some time in the Army, deployed to Bosnia and Kosovo. I'm also African American. So that's two kind of areas of demographic for me that really makes it hard to talk about having a mental health issue. It's not heavily talked about in the African American community or is frowned upon. As a soldier, we don't raise our hands and say, hey, I'm going through depression right now, right? And especially as an officer in the military. So for me, a lot of us, we just suppressed it, or we went to, rather than Google or TikTok back in my day, our doctor of choice was usually Dr. Jack Daniels. So when we have these tools available today, you know, it allowed me to find ways to engage with my own mental health in a way that I hadn't before. But more importantly, I have kids who I use our platform to help them work through their anxiety, depression, through using our tool. And so when I talk about our product, we have three primary products that we offer. One is called the Flourishing course. A lot of what we're trying to do, in addition to just addressing these challenges that you heard, is put a more positive spin or take a more proactive and positive approach around mental health. Looking at, you know, the concept of flourishing and how do you live a more meaningful and purposeful life. You do have 25% of your population that's in a mental health crisis that needs clinical care. But a lot of the people that you're serving are just trying to find ways to deal with day-to-day challenges in a better way, how to live a life of more purpose and meaning. One of those factors is social meaning and building connectivity through your personal relationships. As we looked at the research, that is one of the primary factors that drives mental health issues, and we try to help address that, your psychological well-being, your contemplative well-being, all of those things in our Flourishing course to put a proactive angle on mental health. Our second product is a product called Smart Screen. That's our broadest product. It covers over 100 mental health topics. We cover every mental health topic you can address, all of the diagnosable conditions, but also life factors. Are you dealing with the loss of a loved one? Are you moving and just dealing with moving stress, what a lot of us have been dealing with or going through? We're not going to get into a conversation here, but it is impacting us as election stress. So there are life changes that happen that each of us have an up and down day, but we can address that through our self-care platform with over 100 topics. Every piece of content on our site is evidence-based. We've had AI score it, but humans review it, so people find good quality digital content. We've used design to make it easy for people to find. But then the third product is called Smart Screen. That allows our customers to build more sophisticated rules and their rules engines into a screener so that as you're addressing specific needs of populations or demographics, what we help do is, one, provide the self-care on the front end. For people that only need self-care, they use our platform. For people that need clinical care, we then triage them and navigate them to the clinical care of our customers. So we don't provide any clinical care, but we do that warm handoff from our site to our customers so that they have a better understanding of that patient, that patient's needs, whether that's, they want face-to-face services or they prefer telehealth. If they need a specific language in their clinician, if they're a primary Spanish speaker, we can get that information and hand that information over. So we're trying to personalize how that handoff happens from self-care to clinical care and have a more informed conversation when a patient or a member is seeing their clinician. So that kind of rounds out kind of our product set and what we do, but definitely want to have our customers kind of share how they're using our solution.
That's excellent. And with that, maybe I could hand it over to Jennifer if you do want to add a little bit of context there.
Sure. So one of the, you may hear me say hopeful minds. One of the things I love about Credible Minds is that it's a very responsive partnership. Our state motto is, while I breathe, I hope. Mm-hmm. It is also what our suicide prevention motto has adopted. And so we wanted to rebrand it as Hopeful Minds in South Carolina. And I really talk about this platform. Sometimes I feel like I'm an infomercial because I love it so much. For a state agency to pull down some of its firewalls and allow access for employees to watch podcasts or videos or read articles was pretty huge and took me some hurdles, but we were able to do that. And being able to do that on a community platform is also important. All of us in this field know how hard it is to get real-time data, right? And sometimes your data is 2 years ago. So one of the things that I asked Credible Minds to do was to have a step when a person turns on Hopeful Minds where they identify what county they live in. This begins to let me understand, okay, in the upstate, we're struggling with anxiety and substance abuse. That's what we're pulling up a lot. Over here on the coast, we're looking up burnout and depression, or in the low country, is it primarily parents looking up how do I help my kid, or how do I help myself in parenting skills, which then makes sure that as we are applying resources, because we've already talked about a shortage, that we are applying them appropriately and on a need basis. And I can pull that data every single day, every single hour if I wanted to, about what that county is doing. So it became very informative in that way as well. I try to tell people you should be opening up Hopeful Minds every morning when you open up your email, because part of stigma is removing the connotation that mental health really transfers in your brain to mental illness, that mental health is human health. And if we turn it on all the time, sure, it's our one-stop shop. It allows us to connect to all our crisis resources. I can load state-specific resources that I've vetted. I can ask them. We were hit by a hurricane a couple of weeks back, as you may know, to load disaster resources on the front page for me. But also, I trust it. And I know that it is something that has worked for me, has worked for my son. I don't let him do any social media. I'm a unicorn. I have no social media. Don't look me up anywhere. LinkedIn, I'm not there. And every week, including yesterday, the little booger texted me and said, "Can I get Snapchat?" And I was like, "No, again." But I do let him go on Credible Minds. because I know there's nothing there that I wouldn't trust him looking at. And I want to empower him to really learn how to take care of himself. As a social worker of 29 years and a mom of 2, it's not easy being the child of a therapist, but being able to talk about empowerment and for whatever age they are in our state really matters for us. And being able, when we had the hurricane recently, I'll just say this and I'll pass it along. We had a gentleman come up because we were there providing mental health care. And I said, "How are you doing since the storm?" And he said, "My soul hurts." And we had a long conversation. I noticed that my other partners that were also at the resource event, unfortunately, through no fault of their own, had to keep saying, "No, oh, do you need Medicaid? Yes. No, I'm sorry, you don't qualify in our state." Or, "Do you need food stamps?" "No, because disaster food stamps haven't been approved." We were the only table that said, "Here's a resource for free for you," and it was Hopeful Minds. And being able to say to them, "This is how I use it, let's practice it together right now," and then being able to walk away with something that they can use 24/7 really was very impactful. And because during the hurricane, you're overloaded with where do I go, what do I do, having that one-stop shop really mattered. All they had to remember was get to Hopeful Minds.
Thank you for that. That was great. I'll hand it over to Rachel. Same question.
Sure. So we've taken a little bit of a different spin coming from the payer perspective. Our overall goal over the course of the last 8 years since I joined the Horizon team was, and then subsequently the NovaWell team was, how can we increase access to the best possible evidence-based practices that exist across the country, as well as supporting our local brick and mortar network. And we started evaluating lots of different types of digital and virtual mental health companies, and then subsequently bringing them into our fold. And what we found was very challenging. Health plans rely on their provider directory. And I don't know if any of you happen to like your own provider directory, but it's very hard to find the right thing, and it's very hard to navigate, especially if you don't necessarily know what it is you're feeling or looking for. And when we started working with Credible Mind, the idea was, how can we work together to support a member to navigate into a world that they might not actually realize that they need, and essentially decode symptoms or preferences that they also at the moment didn't realize that they needed. So that for us has been really game-changing in terms of helping the member to find the right in-network option for their particular need at that moment, leveraging all of the different digital and virtual solutions that we work with. And it's been a great opportunity for the different companies that we work with too to have another sort of referral resource into their universes. So that's been important.
Fantastic. And Robin, yourself?
Yeah, sure. So one thing that has been really successful for us, so you could imagine it's, so we are a multi-employer trust, so we handle the benefits, and then we have, 240 not only school districts, but then there's schools under them, so we have thousands of school districts that we're trying to reach. So one thing that has been very successful that we've done with Credible Mind is we have been able to use the assessment tool that they have. They've got many assessments. It's a great way to start bringing down or getting that stigma eliminated, really, or at least working on that, and to increase our members' utilization of the site. So, for example, several years ago, we started doing quarterly assessments, and then we have a gift card incentive too, where we say, hey, take this assessment and enter a drawing for a $100 or a $200 Amazon gift card. So another way to get them in. One we've had, and we've done a couple of times, is the mental health check-in. It's probably the longest one they had. It's just maybe 6 minutes or something to do it. It's not, but it's great. It's comprehensive. And just as Clay had mentioned about flourishing as one of their themes. We have one called flourishing. They have one called flourishing, not floundering, and you kind of see how you're doing on that scale. So when we get the data back, and they're fantastic at data, by the way, too, as far as giving us the data, the feedback, that's really helping inform our next moves and how we're leveraging this with our other the other programs that we have. So there's always a spike. So it's like you can always tell when the assessment hit, because we've got, oh, okay, in this month, December, we did an assessment about holiday stress. We have one teed up and ready to go for December, and then we can kind of see, and they can also tell us, too, while they were in there, were they looking around at some of the other things? What were they interested in? Are they learning more about anxiety? Are they learning more about other issues? As you can imagine, with school employees, especially those who survived the pandemic time with school closures, and maybe their own kids are home, or your own kids are home, and then the school was closed. So the level of stress that the school employees were feeling, and the level of the lack of connection, all of those issues that maybe in particular, with maybe the possible exception of healthcare employees there too, sure, Jennifer can speak to that, were really exacerbated during that time. So what can we do? So we very much emphasized this tool with them too, with the assessments. So thank you.
Yeah,
Awesome.
I'd like to add a little bit on there, and I can talk a lot to a lot of what you guys have said, but I do want to create a couple of pictures around just the variety of the ways that some of our customers are getting the word out and getting, building that awareness and educate and engagement and getting people to the site. Because as Rachel was mentioning, mental health, unlike physical health, people haven't really used as much from their health plan standpoint. Don't really know even if you're dealing with a mental health issue. If your arm is broken. If you're dealing with pain somewhere in your body, but a lot of people don't even recognize they're going through a mental health issue when they're going through it. They just know they might feel a little off, and then don't know how to get to services or tools when they need them. Our customers are doing some fantastic ways of getting the word out there. I'll give some examples. Universities are big users of our product. A lot of universities, when they're printing the student ID card, are printing a barcode to the Credible Mind site on the back of the student ID card, so that when a student feels like something is off, they scan that barcode, they get directed directly to our site. In communities, you have customers that are creating brochures and pamphlets with Credible Mind information with barcodes, putting it in local libraries. We have one customer put it in 75 primary care practices, because primary care is often the first line of defense for mental health. People go to their PCP, the PCP doesn't know how to address it, so they either send you to a specialist or prescribe you a drug. But a lot of times people don't want that type of intervention or don't need that type of intervention. So in those primary care practice offices, they have collateral around Credible Mind, have a barcode, they can scan that, and then educate, at least give that patient a different option, right, to kind of do something about it on their own. I could go on about different ways that customers are using our site, but definitely, excited about the creativity and ways that people are getting it out there. And Jennifer talked a little bit about first responders and how they're using it in South Carolina. I'll give you a different example in the Boston community. Around different counties in Boston, they used our solution for their fire departments, their EMTs, their police officers, because they were dealing with the big opioid crisis several years ago there. By those folks having access to our solution, we're able to divert ER admissions because people weren't going straight to the ER, diverted incarceration, because a lot of times when someone's going through a mental health crisis, they're being incarcerated. So a lot of that on-the-ground intervention, being able to provide tools like this in the hands of those folks that can have a better conversation with someone they're trying to deal with. I mean, we're excited about everything that our customers are doing, but those types of real stories where people are, we're able to help, I mean, that's what gives us passion and keeps us motivated to keep doing what we're doing. And so I just wanted to share some of those kind of stories with you guys.
That's amazing, and we're nearing our session, and I do want to give an opportunity for anybody in the audience to ask questions, but maybe I'll close out, Clay, with one last question for you, which is really around what's next. For Credible Mind, we have heard a lot throughout sort of BHT and even other sessions around AI, the importance of it, how we can see it in technology. Is that going to play a role? What can we expect to see for Credible Mind?
Yeah, I'd love to hear answers from the rest of our customers on this as well. I'll just give quickly from a Credible Mind standpoint. I mean, one of the things that we're seeing in our platform, we have the broadest digital ecosystem of mental health content in the world. We have the largest number of users using a platform like ours in the world. We currently have over 30 million people that have access to our solution in the US. That's over 10% of the population as an early stage company. We're generating data around how people think about their mental health, how they use mental health services, what their preferences are around the types of treatments that they get, what types of content works best or is resonating best with certain demographics. We're learning a lot as we go through this process. What we'd love to learn more is as people are using our site and they're getting navigated to care, because we don't provide the clinical care, but we are a warm handoff as we triage. And what we're really working on is how do we connect the dots across self-care to clinical care? How do we better understand the efficacy of the combination of self-care and clinical care? There's a lot of evidence-based practice in the physical side of health. We know that managing your hemoglobin A1C is what you need to do for diabetes, but if you have a mental health issue, we don't have a large body of clinical evidence around how to treat mental health holistically. We know how to treat it if you're in a crisis, but we don't know how to engage people early in that process, upstream before they get to crisis. How do you prevent that crisis from happening? How do you better maintain people as they have a crisis afterwards? So really, we want to help connect the dots of the data across what we do, what our customers are doing, provide new insights to the market that not only help us help our customers, but can really help our country and the world improve how we live our lives. And our big, hairy, audacious goal is to help the world to flourish. We believe that everyone can improve how they're doing, right? People are going to be in serious need at times, but we can always be on that path of improvement, and that's kind of what we'd love to help do.
That's amazing. Anything else from anyone that would like to add to that?
No, I was going to say let's get to the
Perfect.
questions.
Okay. Yes, I'm happy to give an opportunity for the crowd to ask any questions before we close out. Anything from anyone in the audience? Yes, please.
Yeah. So I would like to know more about retention and engagement on the platform. Like how many sessions or time that most of the people stay around, or like outcomes?
Yeah, that's a great question. So with our platform, because it's self-care, we build a lot of engagement tools and practices into how people get access to our site. But often someone will come to our site, use our solution, then go off and put it into practice, right? So they don't need to come back to our site necessarily to put it into practice. So if you go to an app to teach you that you start using around how to sleep better, you're using that app to learn how to sleep better. You might come back to our site later, and what we build in is kind of regular check-ins. We do what we call mental health check-ins. So quarterly we send out surveys to our users so they can come back and, even if they're not using our site or engaging on a day-to-day basis, because it's not designed to do that, we can get constant updates around how they're doing. They can be reassessed. We're seeing, for people that access our site, average session time is over 6 minutes. It's about 6.5 minutes right now for average session times. But as people come to, but that's because they're looking at content on our site and using it. We have great engagement as we push out, communication through our health plan or other customers, but it's different customer to customer in terms of how engagement works.
I know Clay just mentioned that the site wasn't necessarily built for a continuation, but that's actually kind of what we hope South Carolina will be doing. When I talk about retention and how to use it, like for therapists, I say, this is a great place for you to go research evidence-based care and get a skill or learn, and then go take a training somewhere else. Do this in the session with your patients. Assign it to your patients to go watch a video and come back and talk about it next week. If you're a supervisor, you should be having it up and leading every meeting, beginning with something from Credible Minds. So really trying to get it to be that place that they do visit over and over again, because we've embedded some of our state resources there, and being able to then close the loop. So with 988, we're referring to 988. 988 is referring to Hopeful Minds. With Videra for follow-up AI care that we're now working with, does Videra refer to Hopeful Minds? And we refer to Videra. So it has the potential, and I hope will be something that is a living, breathing access point.
Any other questions? Yes.
And so how, so if somebody comes in that wants, digital self-care, but needs a little more, like what is the handoff? So kind of almost the opposite of what you're doing, what you just described. So how does that work?
I think it depends on how the particular organization has deployed the solution in the background. So for us, it's a little bit different because the intent of it has really been as an access point into care, while also making sure certainly that people have the resources to take care of themselves, in the event that they're not necessarily ready for care. But we built with them a proprietary assessment tool that leverages both preferences, but also lots of different types of symptoms and risk factors for a number of different types of conditions that you normally wouldn't get assessed for if you went to your own physician practice potentially and they just wanted to know if you were feeling anxious or depressed. And from there, we're able to route people into the in-network options for lots of different specialty types of conditions that we partner with, like eating disorder, substance use disorder, OCD, psychiatry, etc. But I think that we all, because have essentially a different perspective on how we're trying to support our own potential members or clients, etc., might have a little bit of a different view on how to leverage the tool.
Yeah, right. So for ours, we are able to customize our front door of Credible Minds. So we have a emotional well-being toolkit, and because we have so many members and they have different health plans, we have Anthem Blue Cross, Blue Shield of California, we have Kaiser, we have Aetna. So we have so many of those networks that they can do. So, but through the toolkit, they can do that. So we can customize the Credible Mind site so it has the linkage right on that front page. And then other programs that we offer through MD Live to see a psychiatrist and things like that. So we have that too. So we have those available right on the front page. So we're able to customize it with them.
And then you kind of go through a local provider or get provider care.
Exactly. Yeah, because for us it depends on who they have, like what network they have. So that way they can do that. Mm-hmm.
Any other questions? Yes, please.
Is there a specific program for students of gun violence, and have you marketed that on national TV?
There is not a specific program around gun violence that we have, but we do have content for a lot of different topic areas around students and how to help students or just young people deal with mental health issues that they might be going through, whether that's, stress, anxiety, depression, or impacts of things like gun violence. And it's providing those tools where they can either, if they're 15 and over, can go through that themselves, or it's content areas where parents can have that conversation with their kids. But and we haven't done any national TV promotion yet, but that might be in our future. But right now, just really working through, our customers to kind of get the word out.
As a nonprofit, you get free public advertising. So if you partner with a nonprofit, you can use that.
That's a great idea. If you have, let's talk. If you have,
I have a nonprofit.
yes, we'll meet right after this.
I'm just wondering about language capabilities, ESL access, and literacy in terms of looking at video
Yeah.
content versus having to have a lot of diverse populations that I serve as a consultant, and want to make sure that this is accessible as a tool for diverse populations.
Yeah, great question. We put a lot of work into the design and verification of, reading level, language level, and, making it accessible. So all of our content is translated into every major English with machine translation. So that's relatively easy to do. You can just click on the language that you want and it converts all of the content in the site that is translatable on the site into a local language. But we've done cultural translation for all of our content in Spanish. So one of our big customers is Monterey County. They had a requirement for Spanish across the county, and we went through every piece of content on our site is culturally translated into Spanish. But also, try to make all of our content as much as we can. For the most part, is 6th grade reading level or better. trying to get down to 4th grade, but challenging to do in this area because some of the words themselves are just above that reading language, right? We're trying to describe what mental health is, but we put a lot of work into it.
Okay, I think that is our time. We're at time, so I just want to give you the moment.
Yeah,
to-
just one thing real quick before you go. One, just really appreciate everyone being here. We did create a Credible Mind branded site for behavioral health tech. So behavioral health tech branded version site, there's a QR code there. If you scan that QR code, that will give you direct access to that site. So you can try our site out for free while you're here. It's a limited time on this, so you're not going to have this in perpetuity, but we've built also some of the content of the conference into the site as well. So we just welcome you to give it a try. We'd love to talk to you while you're here if you're interested. And thank you so much again for spending some time with us today.
Thank you, everyone.